Ideal. Thank you, Rose and Jim. I appreciate it. I think we all agree that this is a very worthwhile initiative, and I think we'd all thank you for taking the time to put in the effort to set these types of webinar series up. We all agree that in our market, it's all about improving patient incomes while enhancing lifestyle, right? So, thank you again. And I want to take a moment to thank all the attendees for joining. Appreciate you holding your questions to the end. I tend to get off topic pretty frequently, so one question could really derail some of the information we want to transmit. So thanks for your patience in jotting down a note and then covering that at the end. I expect the presentation to be about 20 minutes, maybe 15, so we should have about 5-10 minutes or so at the end to walk through anything maybe I didn't cover clearly enough through the presentation. I am filling in for Rob Clear. He's our regional director there in the Midwest. Who's working with the association. Just a little bit about me quickly. I've been with Compass Health for over 10 years now. I started when we were just Roscoe Medical and was a part of the acquisition when we incorporated Current Solutions, who is our pain management arm now, officially in the therapy channel as Richmar. The addition of our retail line through the Carex brand happened in early 2014. So again, have a lot of insight for our company and what we're trying to do for the industry to make sure we are supporting your needs as our customers. All right, so before I really kick into the presentation, we are going to focus on two items, right? The AccuRelief brand. I know on the deck page we say TENS. It is a TEN therapy device, and I want to get into that. And then the Lumen device through our partnership with 3B Products. So a quick overview of electrotherapy. These are devices that work in slightly different ways, of course, depending on the type of problem they're treating. Certain devices excel at treating pain, others specialize in muscle stimulation. So really what the difference is with electrotherapy devices is the waveform. We're going to talk specifically about two of those today with our AccuRelief brand in your retail setting, one being TENS. This is designed to stimulate sensory nerve endings and used for temporary pain relief. EMS, a little different, which is designed to stimulate muscle motor nerves that help to re-educate muscle tissue. It's a proven way of treating muscle injuries. So what we're really getting at in the difference between the two is a couple of terms I want you all to be familiar with. Pulse amplitude, pulse rate, and pulse duration. Again, that was amplitude, rate, and duration. Really, what it means is how strong does it feel in the way it's measured, what the intensity is, beats per second, and then with duration, it's the period of time between the edge of the waveforms. All right. So again, pulse amplitude is how strong it feels, pulse rate is beats per second, and pulse duration is the period of time between waveforms. So really with TENS therapy, we're talking about short-term temporary pain. And the basic concept is it's going to block basic nerve pain. It's going to be really similar to rubbing your elbow after you bang it on the table, right? You want a distraction to get your mind off of the pain. And that's really what TENS therapy is all about. And again, there's different strengths to those prescriptions. EMS is a little bit different because EMS, which stands for electrical muscle stimulation, this is used to elicit a muscle contraction for strengthening and re-education of the muscle. Of course, it reduces pain, and that's through the help of an increase in circulation. So this, again, assists with light muscle atrophy. It is designed to rebuild muscle fibers, and it is a basic muscle therapy.
Dan, if I can interrupt for a second, it appears that your slides are not advancing. We're still at the intro slide.
Yeah, no, that's okay. I wanted to get into an introduction on what TENS therapy is.
Perfect.
And now we're going to move into it. Okay.
Perfect. Thank you.
And Rose, as you stated, we're going to be able to send out this deck to everybody that participates, right? To make sure that we all have a copy of the presentation. So here is the first slide, and again, we got into what TENS therapy is. So now we're going to talk about what we're going to put on your shelves, right? So the idea between the AccuRelief brand is presentation and presence, right? So it's a store within a store concept is what we call it. So everything we're talking about today, even though we talked about TENS therapy and EMS therapy, is what the AccuRelief line represents. So this first device I wanted to mention is, as we get into a basic, better, best category, is our basic model, okay? And really all of the items we're talking about are going to be a razor blade type mentality, where let's get the device in the hands of your consumer, and then let's get them coming back for the replenishment of lead wires, electrodes, and such to keep continually using the product, all right? And when we get into the basic model of electrotherapy for a TENS device, we're talking about a single channel TENS device. Then we have a dual channel, and then we have some wireless devices. But all of them have the same concept, which is an ability to pinpoint the pain area and then offer some treatment. So, as far as the offering starts, we think the basic model would be a single channel TENS unit. Of course, it's going to come retail packaged. One of the features we offer that we think is a significant advantage is the Easy Snap electrodes. And the way we kick it off with the single channel pain relief device, we offer 6 therapy programs. They are specific body areas that's just selected through a simple up-down scrolling button that'll let the patient say, okay, well, if I have back pain, let me scroll up to the back picture. If it's in the neck or shoulder, there's a shoulder picture. If it's in the leg, it's the same thing, they're choosing the leg. We offer 25 levels of intensity, and each treatment session is about 30 minutes, all right? And just to help with some of the relief on adding a new SKU to your offering, this product represents about a 50% margin for you at the MSRP of $39.99. All right, so a 50% margin on the unit. For the refill packs on electrodes, we offer both a small and a large pack. The small pack is about 8 pads. The large pack is 16 pads, okay? Each pad lasts for about 30 uses. And again, this is going to be dependent on the user. Are they using the product right after a shower? Is at the end of the day, is the skin a little oily? So, there is some usage requirements per patient, but you typically get about 30 uses per pad. So we're offering anywhere from 4 to 8 months with the refills. All right. The margins on the refill pads are closer to 60 and 75%, depending on the MSRPs of $12.99 for the small and $19.99 for the large pack. Okay, and again, those are Easy Snap electrodes. They do come with lead wires as well, so you're replacing any of those wearable parts outside of the device. The better model, again, basic, better, best for your offering on your shelves, would be a dual channel TENS. The dual channel TENS offers an additional lead wire. This way you could really surround your affected pain area and get enhanced benefit. So we also enhance the device itself, where our dual channel offers 12 programs. There's 6 that are preset. And again, the presets are, they correspond to body parts. And then there's 6 additional therapy programs for tailored treatment. So that'll take you to the next step of therapy. Again, still 25 levels of intensity, and then this is set at 30-minute treatment sessions. All right. The MSRP, again, being $49.99, which is about a 50% margin for you. Then when we get into another offering, which again could be the best, we're looking at remote control wireless TENS unit. Now you don't have a device that you have to put in your pocket or clip to your belt loop. You don't have to rest on the table because you're wireless, you're detached, you're able to move. So with the wireless pain relief device, you have a remote control. The kit does include 2 gel pads. And again, all TENS devices through the AccuRelief brand are available without a prescription. Right? These are FDA cleared for safety. It's a drug-free solution for any arthritic, muscular, joint, back pain relief. And again, back to the device for this wireless. It's one set program with 3 therapeutic phases. It's the same 30-minute treatment session and 25 levels of adjustability, but this package does include a storage pouch, again, because you have 3 separate components, right? You have 2 leads, which are the electrical components attached to the pads that you put on your body, and the device. All right. This product, again, the same. You see the MSRP, about $90, and margins about 50% for you guys. These wireless remote replacement kits, the supply kits, usage is about the same. It's about 30 uses per pad, and we send those out in 2 sets of 2, so you get 4 pads in the resupply kit for the wireless unit. Okay, and again, margins about 75% on the resupply kits for you. In that same mode of wireless technology, we do offer a mini TENS. This is for targeted pain relief. This isn't wireless because the leads attach to the electrodes, but this is a combination program, right? This easy device with 2 gel pads. It's pre-programmed. The only 2 buttons you see on the device is the plus and the minus. Those will change from intensity through the combination programs, the easy-to-use user manual. Again, comes pre-programmed. The treatment cycle for this mini TENS is 20 minutes, a little bit lighter, but again, this is for convenience, right? You want to use this similar to what one of the big brands, Icy Hot, has Shaquille O'Neal advertising with the Smart Relief pads. That's just a 1-pad product, where this instance you're having 2 pads that would be able to surround your treatment area to enhance the blood circulation and treatment benefit. And again, margin on this device is closer to 50%. Now as we get into the most comprehensive of the AccuRelief line is our brand new 3-in-1 offering. And again, this would be part of that best offering as well. This is a combination device. So the therapy modes are both TENS and EMS, but it includes a massage function as well. So again, TENS is just like the rubbing effect on your elbow if you bang it, and EMS is actually going to help rebuild and repair muscle fiber that could be damaged, so actual treatment. So this is controlled through remote control. It's got a digital screen, but it also offers a feature for you to download a mobile app through the Apple Store or the Google Play if you have an Android device. On top of the dual treatments, this also offers a treatment history, satisfaction tracking. It's got the built-in manual right in the device that you can access through the app. It has an electrode placement guide, and it offers a FAQ for frequently asked questions, right? So all of that's accessible through the app in the App Store. This device comes with 14 preset programs. It has 60 levels of intensity through 12 treatment zones of Goer's treatment zones or body parts. So that's back, knee, neck, shoulders. It's accessible through Bluetooth connectivity through the remote device or your cell phone's app. And of course, it comes with a USB charging cable for the wireless unit. So we're really excited about the 3-in-1 line. And again, this the wireless TENS with phone app we think is a fantastic feature that can really jump off the shelves for you. Now, a little bit different, other than just the TENS devices, we do feature, and we've had for a few years now, the Ultimate Foot Circulator. Now, what the idea with the foot circulator is for is it focuses on foot and leg muscles, of course. And the result is that the foot and calf muscles contract and release. This creates a pumping action. All right. This action imitates the body's natural circulatory system in the legs while walking. No different than any other item up through the AccuRelief brand. It's available without a prescription. It's FDA cleared for safety, and again, a natural drug-free relief without side effects. It offers 3-channel stimulator. So you would use the lead wires and electrodes to come up through your calf, shin area, or just below the knee for your treatment. The functions are controlled by device panel or remote control, and then we offer 3 LCD screens to display. There's treatment time, body stimulation intensity, and foot stimulation. You see the MSRP listed at $249, and again, we're at about a 40% margin on this item. And these are complementary products to go along with the AccuRelief line of electrotherapy. And again, this is broadening the presence on your shelf to support over-the-counter TENS, right? So we do offer a full line of kinesiology tape. Kinesiology tape is elastic athletic tape. It acts like a brace that supports injury and allows you to continue activity. The idea is to allow more movement than a brace so you can remain active. It lifts the skin to allow better blood flow and reduces swelling, which helps prevent injury. Our product is a cotton-based product. It only stretches north and south. There are some competitive products that go north, south, east, west, but this helps maintain some of the durability of the product. It's wearable for 5 to 7 days of full activity. It is the premium brand in the industry, and we can get real aggressive with pricing to maintain your margins through your market. You'll see Strength Tape has the perfect amount of breathability and stretch. There is an industry standard acceptable range of 135 degrees to 145 of stretch. Anything higher than 145 starts to break down the product. So we've found that range, and it's worked well for us. Your options with the kinesiology tape, the brand Strength Tape, is through pre-cut rolls, which come 6 feet long. In the pre-cut rolls, you're going to get 20 pre-cut strips that are 10 inches long. That's more of the mainstream retail side. You put that on the shelf, and that's easy to use for your consumer. However, the preferred method for doctors or clinicians, physical therapists, is the uncut rolls. And we offer 6-foot and 72-foot rolls, which doctors prefer because it cuts down on waste, right? It's just a full roll similar to any other tape. You'd roll it out, you'd apply it, you'd cut it. We also offer taping kits with our kinesiology tape. And taping kits are 6 to 8 pre-cut strips in each kit, and there's 2 applications included. Of course, there's instructions on how to apply it for the specific injury, and they're available for most common injuries. We have ankle and foot, back and neck, knee, calf, quad, and shoulder. And the demo on the screen for the Sub-Zero, that's a topical analgesic, similar to BioFreeze that might be on your shelves. This is a patented product with cat's claw. The proprietary blend's a little bit different, and we've seen remarkable results when it's been paired with the kinesiology tape. And we've even had some therapists recommend applying the topical analgesic right on top of the kinesiology tape to help enhance the blood flow as the tape is lifting the skin, enhancing the circulation. So using the combos together or individually, both has proven some direct benefits, again, to enhance the lifestyle of the active patient to improve their outcomes. Okay, so that was through the AccuRelief brand, some co-product to help increase the presence with Strength Tape and Sub-Zero. And then the other offering we're going to get into today is the Lumen CPAP Sanitizer. The Lumen CPAP Sanitizer is the easiest, fastest way to disinfect your CPAP mask, your reservoir, or other accessories, and it doesn't use water, chemicals, or harmful ozone. So the source completes the disinfection cycle in just 5 minutes and kills 99.9% of the bacteria and germs. It significantly reduces the risk of infection from improperly cleaned CPAP. So it uses a UVC classification, and there's 3 rates of UV. There's A, B, and C. And UVC is considered to be the safest disinfection option on our market today. Ozone used in other systems have been shown by the EPA to cause irritation of the lungs and respiratory system at relatively low amounts. So, there's still some information or fact-finding going on about that product. The Lumen CPAP UV sanitizer is the ideal maintenance-free accessory for today's CPAP patient concerned about hygiene. This is a mat-protected product. It's simple to use with a 1-button operation. In the purchase of the product, we do include sample CPAP mask wipes, and it has a 24-month warranty. So just some differences overall with the SoClean Lumen warranty, 24 months. There's no filter replacement. You don't have to worry about that expense. There's no pre-wash. You don't have to worry about the pre-wash expense. Again, the difference really is the UV versus ozone. They're rated to kill the same amount of germs, no adapters needed, 5 hours versus 2 hours, and MAP protected at $249. So with the initial bundle, the disinfection unit, you get the product, you'd get sample sanitizer wipes for the consumer to test out in case they wanted to come back to buy more. And your price is $149, MSRP $299, MAP protected at $249. So that's the Lumen CPAP device. Real quick, I kind of opened with some of who we were as a company. As far as our retail offering goes at Compass Health, Carex is a big brand box, but AccuRelief really can work well in your storefronts. As far as an option, we do have the TheraMed hot cold line, the Bed Buddy moist cold therapy line, and then Apex is our full line of medical compliance. So those are your pill cutters, your pill storage containers and such. And we do some of that stuff make to order. So if you had special requirements, we could help with that line. And again, for those of you that don't know, Compass Health's full line of offering, the intensity device is our professional that does require prescription through the pain management channel. Pro Basics is our basic mobility bat safety. We went over the retail lines. Roscoe Medical is our CPAP respiratory brand. Meridian Medical being our pressure prevention. Airlift our oxygen carriers. So Rose, that was the presentation. It looks like we have about 6 minutes left if you want to open it up for questions.
Okay, I did open up everybody's line, so you're all open. I know there's a question or two that we received during the presentation, so we'll open it up. Dan, there was one question on your CPAP, if it was reimbursed, or not your CPAP, but on the 10 units, the question was, are they reimbursable by insurance?
So the AccuRelief line is not reinsurable by insurance.
I want to grab this for while you're there.
And just a reminder, everybody is open. Your lines are open. So in case you are talking, go ahead, Dan. Sorry about that.
Oh, I appreciate it. Thank you, Rose. So the AccuRelief line is not reimbursable by insurance. We do have those professional devices through the Intensity brand or the Richmar brand, but the AccuRelief should be on your shelves, and they're designated for over-the-counter sales, not reimbursement.
Perfect. Other questions from participants? All right. Well, hearing none, you will have an opportunity, if something does pop in your head, go ahead and send us an email at the MAMES office, info@mames.com. I would like to take this opportunity to thank everyone who participated in today's webinar, and especially thank Dan and Compass Health for their time and their information. I think it was great. We will have Rob follow up with all the participants, and we'll send you a copy of the presentation. So if anybody has any questions for Compass Health, you can communicate that way. Outside of that, we look forward to seeing many of you at the MAMES Fall Conference in 2 short weeks, where we do have a full-day retail seminar. That's a combination of both having the retail experience but also incorporating the reimbursement model as well. Without further time, does anybody have any questions? All right. Well, we thank you so much, and we look forward to talking again in the next webinar in January.
Ideal. Thanks, Rose. Thanks, Jim. Thanks, everybody, for attending.
Thank you.